Hi everyone, this is the Interdisciplinary Environmental Clinic team at WashU Law. I'm AK and I'm here with Callie, Ugbad, and Zach. We've enjoyed presenting at the Solution Series meetings the past few weeks, and we're excited to see all of the community voices culminate in the summit today. Our presentations in previous weeks looked at 8 specific environmental justice issues and briefly touched on how they relate to the current COVID health crisis. These issues included air pollution, asthma, vacancy, illegal dumping, food apartheid, home energy costs, lead, and mold. If you want to learn more about these issues, you can watch the presentation recordings on the website, environmentalracismstl.com, or you can read the Environmental Racism Report, which is also available on the website. Today, we want to re-emphasize how environmental racism is contributing to COVID's disproportionate impact on Black St. Louisans.
To begin, we first want to take a moment to remind everyone how to stop the spread of COVID-19. Physically distance and stay at least 6 feet apart from other people. Wear a mask in public and make sure it covers your nose and your mouth. Do not touch your eyes, nose, or mouth. And when you sneeze or cough, make sure you use a tissue or your elbow and then wash your hands. Clean and disinfect frequently touched surfaces. Stay home when you're sick, unless you're getting medical care, and wash your hands frequently. And now, a brief update on the state of COVID-19 in the United States and St. Louis.
The U.S. has seen a huge uptick in COVID cases in recent weeks. As of the beginning of this week, there have been almost 10.5 million cases of COVID in the U.S. Over 241,000 Americans have died since January. This past week, we've been seeing more than 100,000 new cases each day. The numbers have been ticking upward in St. Louis City as well. In the past week, there have been days with over 100 new cases, 9,433 cases total, 216 deaths. Additionally, there is now the rising problem of what experts call long haulers. Significant percentages of COVID survivors have relapses, heart damage, psychological problems, memory problems, develop stutter, hair loss, etc. Given the novelty of the virus, we do not know whether these long-term symptoms will resolve or be permanent.
As we've discussed, the burden of COVID-19 falls most heavily on Black St. Louis residents. As of October 19th, in St. Louis, there is a 75% higher case rate for Black residents as compared to white residents. Even more concerning is the fact that Black St. Louis residents are almost twice as likely to die of COVID, with a 94% higher death rate. These stark disparities seem to be diminishing a bit in the last couple of weeks, but Black residents of St. Louis are still disproportionately impacted by the disease. COVID-19 is emphasizing the structural disparities that Black St. Louis residents face, and this is clearly seen in COVID's connection to environmental justice issues.
Air pollution is more than just a catalyst for global warming. The air we breathe can have dramatic effects on our health. Unfortunately, for communities of color in St. Louis, the consequences of air pollution tend to be more severe. This was magnified with the emergence of COVID-19. The 2 pollutants on the slide were highlighted by studies at Harvard and in Europe for exacerbating COVID-19 and are very commonly emitted by vehicles and coal power plants like those which surround St. Louis. We also know that many of the city's permitted air pollution sources are located in Black neighborhoods, and that many Black neighborhoods either sit along or between major highways. It is no coincidence that the zip codes with the most polluters are minority communities, or that these zip codes have the highest rates of COVID-19 infection. Exposure to air pollution also puts you at risk for respiratory and heart disease, both of which can increase COVID's mortality. While more research is needed, it appears that air pollution was a factor in the horrendously disparate rates of COVID-19 infection and death in the Black community here in St. Louis.
Asthma treatment is centered around prevention. Black St. Louisans are disproportionately impacted by lack of access to affordable and quality healthcare, which can cause negative impacts on their asthma management. Though asthma is a widespread issue in the St. Louis region, the burden falls most heavily on Black residents. And in particular, the burden falls on Black children. In 2015, Black residents in St. Louis made emergency room visits for asthma 8.5 times more than white residents. The disparities for Black children are even more severe, making visits to the ER for asthma treatment 10.8 times more often than white children. The most recent CDC update states that adults with asthma might be at an increased risk for severe illnesses from the virus that causes COVID-19. While the link isn't clear, it is safe to say that the burden of living with asthma as a Black St. Louisan has been exacerbated by the pandemic. Burdens of accessing primary care during the pandemic, costs of asthma treatment during the pandemic, and the impact of staying at home orders and stay-at-home orders that have impacted the health and well-being of people, making them stay in substandard housing.
Vacancy has negative physical and emotional impacts on communities. In St. Louis, these burdens are primarily borne by Black residents, and the impacts of vacancy have been made worse by COVID. The negative impacts of vacancy can be seen through the impending eviction crisis. Currently, there's a federal moratorium on evictions for non-payment, but it expires in less than 2 months on December 31st. The moratorium provides no safeguards besides protection from eviction, and on December 31st, many will become vulnerable to eviction and will experience homelessness as they cannot afford to pay months and months of back rent and fees that have accumulated and will immediately become due. A study done this July across 44 cities and counties found that when local and state moratoria on evictions expired, filings to evict tenants almost returned to their pre-pandemic levels. This demonstrates to us that once the federal moratorium is lifted, there is likely to be a surge in evictions here as well. Further, as tenants are unable to pay rent, landlords cannot pay their mortgages, which can lead to foreclosure on rental housing. When the rental apartments and houses are foreclosed on, the availability of housing plummets, and this ultimately increases vacancy. Although we haven't seen this occur on a great scale yet, the end of the eviction moratorium looms large. The threat of eviction also is a threat of experiencing homelessness, and the unhoused population is already at a greater risk of exposure to COVID because of lack of access to essential hygiene and the inability to properly social distance in shelters. Additionally, these concerns are compounded by freezing winter temperatures and flu season.
During the pandemic, there has been an increase in illegal dumping reports across the globe. No data is available for St. Louis yet, but there have been reports across the country, such as in Los Angeles, and across the ocean, such as Dublin, Ireland. Each year, aldermen also receive funds for projects in their wards, including alley maintenance, street repair, and dumpster replacement. This is often referred to as ward capital or ward funding. But during the pandemic, this funding has been stopped. Currently, no ward capital is going into replacing damaged dumpsters or maintaining streets and alleys, and many waste conditions that existed prior to the start of the pandemic have not been fixed, despite the intentions of aldermen. People are also spending more and more time at home and within their communities because of social distancing guidelines, their work or school being moved to a remote setting, losing jobs, and because many events and activities have been canceled. This has increased exposure to illegally dumped trash in various communities.
The most recent CDC update on COVID-19 states that adults living with obesity and diabetes, both of which are linked to food apartheid, might be at an increased risk for severe illnesses from COVID-19. Coupled with increased inactivity and minimal social support, COVID-19 has negatively impacted people's normal food patterns. In particular, the burden of food apartheid on Black St. Louisans has been exacerbated by the pandemic. COVID-19 has worsened food insecurity for many school children whose families relied heavily on school food programs in order for their children to receive healthy foods. Additionally, low-income families have been impacted the most by the pandemic, burdening them with minimal access to healthy and affordable food and causing them to spend more in order to eat nutritious food. All of these factors continue to reinforce the cycle of poverty, forcing those who can least afford it to always pay the most.
COVID has increased home energy costs for many, as people are staying home more to decrease their risk of exposure to COVID. A study on New York City apartments found a 23% increase in home energy use since the beginning of COVID. This increased use leads to increased costs, and low-income and Black St. Louisans face a higher burden of keeping their homes powered and at a comfortable temperature, as many are stuck at home with inefficient houses that let expensive AC and heat out through leaky doors, windows, and cracks. Those in formerly redline areas of the cities, which are primarily Black neighborhoods, face a higher burden as redlined areas are about 5 degrees hotter than unredlined neighborhoods across the nation. And this is due to having lack of access to green space and having a lot of concrete and highways and roads that absorb and radiate heat. And this makes it more difficult to cool down homes. And with staying at home, it makes it hard to stay active and healthy as there's that lack of access to green spaces and parks. I've included a link here to get help with home energy costs.
Lead poisoning is associated with some conditions that make people more susceptible to severe COVID complications. For example, lead poisoning can cause organ damage, and some studies have associated it with cardiac issues as well. As we have mentioned previously, people are spending more time at home during the pandemic. This increases their exposure to problems like lead in their homes. Across the country, landlord and government capabilities to perform ongoing lead hazard inspections, controls, and abatement have been decreased because of the pandemic. This can be further exacerbated in situations where landlords are not receiving rent money and can't evict due to moratoria, and are thus refusing or unable to make the necessary repairs. Shortages in personal protective equipment may also lead to further delays in lead hazard repairs. And increasing numbers of tenants and homeowners are resorting to making interim repairs on their own without proper safe work practices and lead dust testing. There has also been a sharp decrease in pediatric doctors' visits during the pandemic, resulting in a decrease in blood lead testing measures. And finally, childhood lead poisoning can cause intellectual and developmental disabilities. The global pandemic has had a disproportionate impact on those with these types of disabilities. Many with these disabilities require in-home care, social interaction, and various therapies that are limited by the constraints of the pandemic. And shifts to telehealth and online education that many of us have been experiencing are inequitable for many in the disability community.
Living in a moldy environment has both psychological and physical impacts on an individual. Unfortunately, in St. Louis, most of the areas most impacted by interior mold are majority Black neighborhoods. Early research has shown that COVID-19 can make patients susceptible to a fungal infection caused by a very common type of mold. This infection usually only affects the immunocompromised, but in some cases it has been found in up to 30% of patients with severe or fatal COVID-19 infections. The respiratory issues caused by or exacerbated by mold may also increase the severity of a COVID-19 infection. Not only is mold making COVID-19 patients sicker, but it has also forced many people to spend drastically more time indoors. For those living in moldy environments, this means more exposure, which can lead to more asthma attacks and other respiratory issues. Cleaning products, like those that someone would try to use to remedy a mold problem themselves, can also trigger asthma attacks. This is important because in this era of social distancing and isolation, many people may be hesitant to invite a stranger into their home to try to fix the problem, making it more likely that they try to fix it themselves. COVID-19 has dramatically changed the way we live our lives, and those living in moldy environments have felt this in a way that many others have not.
To conclude, we want to remind you all to wear a mask and to physically distance. Thank you very much.